News on the hour. News Radio 1190 KEX, Portland, Vancouver, Salem.
I'm Lillian Shirley, and I'm the director of the Multnomah County Health Department.
Our top story, the H1N1 virus hitting Oregonians hard. Vaccines continue to slowly trickle in, targeted at at-risk groups.
Change is hard. It causes fear. But public health practice has been evolving, and we had to take a leap there.
I wanted to bring over the quarterly financials for you. It's not looking particularly good. We're at about a $2.9 million shortfall.
Our resources have been declining, and I think that that's a trend that we're going to have to face. We have to really think about how we spend those dollars for the public, and that's part of our public trust.
What I am concerned with is depending on our capacity.
When the day was done, we cut 50 positions. The year before, we had a budget of about $151 million, and this year we have a budget of $136 million.
The way to reduce our costs over the long term is to reduce the dependence on the services we provide. That means focusing on prevention. And Lillian has been not only regionally a leader, she's been a leader nationally at looking at prevention strategies.
I think you have to be really clear about what your mission is. You have to be really clear about your values, and you have to constantly come back to them for all your decisions.
Good morning, Mr. Kaplan. This is Angelica. It's time for your medication. Could you please connect yourself? Okay. How are you today?
We were able to decrease the number of outreach workers that were necessary. We were able to ensure that the family had control now over when they took their medicine because they could make an appointment.
Okay, are you done? Can you show me, please, the packet? Okay.
That worked better for the client, and it works better for the budget. And we're seeing really good results. People really like it.
I will call you Tuesday, okay? Thanks. Okay, bye.
Are your sexual partners male, female, or both?
Females.
And when was the last time that she tested for HIV?
We've actually found out that it increases the patient's compliance.
Have you had any problems having your blood drawn? Have you ever fainted or anything?
And it also means that we get better flow through the clinic.
How are you feeling?
Doing wonderful.
Oh, great. Okay, so that's for the syphilis and HIV.
Okay.
Where you see the most cockroaches, that's where you need to put more powder. There's a big problem with cockroaches here, and that's an asthma trigger for the child. I came to explain how to use the products we provided for them, which was a roach powder and some traps.
That fits in with our philosophy of always moving upstream.
Where is the powder?
What was it that got this person in our door? And let's check and see what can we do to keep that person from needing our services. And that's kind of public health practice in a nutshell. We're the demand reduction end of the healthcare system.
We need to have lots of people with tickets and ready to flow in right away. Work at your pace, but be as efficient as you can.
Responding to the threat of H1N1 in our community has been a strain. So the staff has had to really be very creative.
Lillian is able to move people where they're most needed at any given time. So the people currently operating our H1N1 functions all have other responsibilities and jobs within the health department.
Here for a shot?
Yeah.
Okay, just go right in here, please.
Okay, thank you.
This is the result of years of training.
1, 2, 3. Great.
When it looks smooth, then that's what we want. You don't know all the work that went into it.
se necesita esperar una semana o dos.
In our jurisdiction, the largest minority population is Latino. So we have already a lot of really good relationships with that community.
¿Cuántos meses tiene el bebé?
8 meses, ya va a cumplir 9 meses.
Oh, sí, está bien, él puede recibirla.
One of the smartest decisions Lillian has made is she has protected the core obligations of a public health agency. So while there are mergers in her department, while there are realignments of services, while we do continue to shift resources towards prevention strategies that support our citizens in the long run, she has never forgotten that as a public health agency we have specific obligations.
What saved us was public health is very mission driven, and we stuck to our mission. We really articulate what were our values here and saying we're going to get to this number, and getting to this number, these are the things that we're going to hold sacred.